So, hello to everyone. I'm Pierre Parnex. I'm the president of the French Society for Hospital Hygiene. It's my great pleasure to open this Paul Weber teleclass today. Today, as you know, or you not know, it is the Clean Hospitals Day, a very important day to promote environmental hygiene. So for us, it has been a very long day in Geneva, but a fascinating one. And it's still the time to share your vision on social media during the lecture to come on this topic. It's important. So it's my great pleasure to welcome today Professor Didier Pittet. It's not necessary to present him, as I was yesterday in a restaurant and all the person dining around me knew who was Didier Pittet. So I think that professional of infection control like you know him fully well. He's here especially as the creator of the Clean Hospitals Initiative, which is very important and started in 2018. And for us, it's a vision, it's a perspective to improve infection prevention that is really important, and he accepted to carry that the way he carried the hand hygiene project, so the perspectives are very interesting. And now Didier will explain us his vision from clean hands to clean hospitals. So Didier, you have the floor.
Thank you, Pierre. It's a great pleasure for me to be here and for me to speak to you. Today, as Pierre said, we have the Clean Hospitals Day, which is a very important day, like the 5th of May of every year, where we celebrate hand hygiene. On the 20th of October each year, we are celebrating the Clean Hospitals Day. Now, the title, as Pierre told you, is From Clean Hands to Clean Hospitals, 2005-2022, as you can see on my title slide. Let's move to the first slide. The first slide is a slide where you see, welcome to the hospitals. Infections are waiting for you at the entrance door of the hospitals. You know this cartoon that I am using for many years. You know the numbers that are at least 500,000 patients getting healthcare-associated infections each day in hospitals only around the world. Slide number 3 is summarizing for you two key numbers. First number, the one I used right now, 500,000 patients getting healthcare-associated infections each day around the world. And the second number that is so important also, which is actually telling 16 million deaths. 16 million deaths every year just because these people are acquiring healthcare-associated infections. Remember, 16 million deaths every year. It's more than AIDS, tuberculosis, and malaria together. So it's a huge number, making healthcare-associated infections first priority in public health. The next slide, slide number 4, is showing you the daily impact of hospital infections in the USA. You see a plane, and slide number 5, this plane, slide number 6, is crashing. Slide number 7 and slide number 8, you see a huge fire. All people on board have died. They have died because of the airplane crashing. Now, obviously, healthcare-associated infection is killing every day in the USA only the equivalent of a 747 airliner crash. And this is what I wanted to show you through this pseudo video, if you like. Slide number 9, importantly, however, nobody speaks about it. Nobody speaks about it. It remains taboo. At least it remains taboo when we started. Mentioned on slide number 9, a silent pandemic. So think about it, a silent pandemic. Nowadays, everybody knows what is a pandemic, right? We have been sustaining a pandemic for the more than 2 years that bring us healthcare-associated infections. I like to call it a silent pandemic for the past 30 years. And that's the term I use because people didn't want to speak about it. Next slide, slide number 10. Now, we know that health infections could be reduced through improving hand hygiene. So that's why we started the program Clean Hands, right? So in the program Clean Hands, I would like to try to summarize for you 4 elements. We start. What did we do? Where are we today? And where do we go? Let's move to the first slide, slide 11. Where did we start? Slide 12. Well, you remember that compliance with hand hygiene, when monitored, was systematically below 40%, right? We knew that hand washing was the most important step to reduce healthcare-associated infection, but we also knew that compliance was very low. Slide number 13. As I used to say, no hospital, no country, no healthcare system in the world could claim to have solved the problem of healthcare-associated infection. So obviously, this problem is a very universal problem that we all need to address. Slide number 14. What did we do? Because hand washing with soap and water was so inconvenient and somewhere less efficacious, we decided to actually adapt a system change. We replaced soap and water hand washing by the use of alcohol-based hand rubbing. And it was a system change that we introduced at the University of Geneva Hospitals in 1995. Slide number 15. You probably remember the successful results of our campaign published in the Lancet in the year 2000 with a drop of healthcare-associated infections of 50% that was observed after only 4 years that we started the campaign. Slide number 16, we could demonstrate also the cost effectiveness of the strategy, the so-called multimodal hand hygiene promotion strategy, including system change, and we could say that it was highly cost effective, considering that for each $1 invested, there would have been a return on investment of $25. Slide number 17. You probably remember that this paper was published in the Lancet, Effectiveness of a Hospital-Wide Program to Improve Compliance with Hand Hygiene, Lancet, 14th of October 2000. The Geneva model of hand hygiene promotion was then reproduced with success between 2002 and 2005 in single hospitals in France, in Belgium, in the USA, in Australia, as well as in multiple hospitals in Asia, in Australia, and in Europe, as well as in national promotion campaigns in Belgium, the UK, and Switzerland. Slide number 18. What did we do, in fact? Slide number 19. In fact, what we did was reviewing the evidence, constructing a multimodal strategy, editing new guidelines, driving implementation tools, field testing the implementation strategy, allow people for adaptation, conduct promotion campaigns, obtain endorsement at all levels, including at political level, monitor the levels of compliance, return and feedback this level of compliance, organize train-the-trainers program, and drive excellence in hand hygiene. The next slide, slide number 20, show you a summary of what is called the implementation strategy and toolkit for the WHO guidelines on hand hygiene in healthcare. Based on the fact that we developed the evidence, we developed tools for action at the bedside. Slide number 21 is summarizing for you the so-called WHO multimodal hand hygiene improvement strategy made out of 5 elements. Those 5 elements being, in fact, system change, training and education, evaluation and feedback, reminders in the workplace, and institutional safety climate. So important, those 5 core components, 5 core elements of the multimodal strategy had to be implemented at the same time in order for the strategy to be the most efficacious. Slide number 22. You are all perfectly aware of the My 5 Moments approach for hand hygiene. These 5 key moments for healthcare workers to clean their hands. Slide number 23. You have on this slide a translation of these 5 moments into different languages. Slide number 24. You have the adaptation of these elements. In Australia, they use the blue color for the 5 moments, which is fine with me. In Korea, they use this type of flower. I cannot read it, but I can tell you it was very successful in Korea. And suddenly, slide number 25, Playmobil in Latin America. Slide number 26, Olaf in Germany. And slide number 27, Hello Kitty in Japan, became promoter of the hand hygiene promotion strategy. Next slide, slide number 28. You know my motto, adapt to adopt. If you want people to adopt a new strategy, in particular, speaking of behavior, they need to be able to adapt the strategy. Next slide, slide number 29. Let me give you some examples. Here you have the 2 tools that we use to promote this campaign. Your 5 moments for hand hygiene on the left part of your screen, and how to hand rub on the right hand of your screen. Those 2 tools have been so key to promote hand hygiene all over the world. The next slide, slide 30, field testing of the implementation of the WHO strategy was all over the world. Complementary site testing in more than 500 hospitals where we gave them the tool and tell them, try them and come back to us, tell us if you like it, if this is useful, and if you want to modify it. As well as those sites, those pilot sites that we visited before, during, and after the implementation all over the world. Slide number 31. As you can understand, we tested the strategy from modern healthcare settings to, next slide, settings with very limited resources to, next slide, a very multicultural environment. And it is very, very key to understand that we field tested the strategy worldwide very, very widely. Next slide, slide number 34. We also needed to ensure universal system change. Why? Because in this hospital, in this photo that you see in Bangladesh, it's very, very clear that the hospital has absolutely no way to pay for the alcohol-based hand rub to be made available for every single patient during every single patient care. That's the reason why, next slide, 35, the alcohol-based hand rub formulation became part of the WHO Essential Medicines list, and also because we gave the solution to a solution that is locally prepared, and we gave the formulation to the World Health Organization to make sure it would be available all over the world. Let's move on slide number 36, where it's written, clean hands. What did we do to continue what I discussed? We had these promotion campaigns and obtain endorsement, monitoring level, train the trainers, and driving excellence. Slide number 37 is the way we promoted the campaign, launching it on the 13th of October 2005 from WHO headquarters in Geneva. And as you see, at the time, We were video connected with many ministries of health from all around the world, as well as had the physical presence of many healthcare workers and ministries of health at WHO. Slide number 38, to tell you that the number of countries that have pledged by the signature of the Ministry of Health is very large around the world. It's about 150 countries. We are covering for more than 99% of the world population with this campaign. Next slide, slide number 39, monitor levels, train the trainer, and drive excellence. Slide number 40 is reminding you, what are the tools to monitor practices and ensure sustainability? What is so important in such a campaign? Slide number 41, to remind you about the hand hygiene self-assessment framework that we developed and published in the year 2010. Slide 42, you remember that this instrument has been translated in many different languages, and also the tools that go with the instrument. Slide number 43, where are we today is an important question. You always need to know where you are. Slide 44. Today, you see the WHO Global Hand Hygiene Self-Assessment Survey conducted in 2019, where we can see where hospitals are around the world with their capacity to promote hand hygiene. Slide number 45. Worldwide hand hygiene implementation level. System change. You see the level of system change for more than 3,000 hospitals worldwide. The level of training and education, the level of evaluation and feedback, the level of reminders in the workplace, and the level of institutional safety climate. The overall median score is 365, with ranging from 278 to 430. So it means that we are at an intermediate level. So it's still obvious that worldwide we need to continuously improve the capacity and the effectiveness of hospitals to promote hand hygiene. Slide number 46, worldwide implementation of hand hygiene level according to the WHO region. You can see that also the most advanced region as a median is WIPRO on the right-hand side of the screen, the lowest level being probably AFRO on the left hand of the screen. It's very clear that there is still a lot of progress to make all over the world with promoting hand hygiene, but certainly we have made a lot of progress over the past 15 years. Slide number 47. Where do we go with this Clean Hands campaign? Slide number 48. First, we have organized over the past almost 10 years Train the Trainers program. Slide number 49. The Train the Trainers program on hand hygiene are based on the WHO multimodal strategy. Lectures and roundtables, hands-on stimulation training, sharing of experiences, and evaluation of knowledge pre- and post-courses. Next slide, slide number 50. We run Train the Trainers in Brazil, Spain, Mexico, Malaysia, South Africa, Iran, Thailand in the first years. In 2019, South Africa, Malaysia, Vietnam, and Iran. And then COVID arrived. And we are starting again because next week I will be in Brazil, and in Brazil we will run a new TTT. So important, Train the Trainers in hand hygiene. Slide number 51 is one of my preferred slides. Why? Because it demonstrates the snowball effect of a Train the Trainer program. See, in 2016, we organized a Train the Trainer program in Madrid, Spain, And then in the 17, first train-the-trainer program in Cape Town, Africa, and then in Puebla, Mexico, then Borneo, Malaysia, and so on. Jalisco, Mexico, Mashhad, Iran, Bangkok, 2018. This is for the top of the screen, the blue indication. But if you look at the screen on the bottom part, you see in orange Spain, Spain, and Spain. And then you see Spain again, and Jalisco, Mexico, Tabasco, Mexico, and Mexico City again, and so on. And then Spain again in 2019, and then in Kuala Lumpur, South Africa, Spain again, Shiraz, Iran, and Mexico. And then Izmir, Turkey in 2019, and then even Japan in January of 2020. This is the snowball effect. When trainers are effective, then you got people in their own country promoting Train the Trainers program all over the country. That's a big success of the hand hygiene promotion campaign. Next slide is slide 52. The next step is obviously how to achieve excellence in hand hygiene. And for those interested, you just access www.hhea.info. Now, next slide 53. Be the next Hand Hygiene Excellence Award hospital. Access this website and you will understand. You will understand that by using the hand hygiene self-assessment framework, you may be directed to actually improve and improve and improve. And as soon as you can demonstrate sustainability for at least 3 years in hand hygiene promotion, you may actually decide to try to get the Hand Hygiene Excellence Award and apply for it. Next slide. Slide 54 is indicating to you that for the past 15 years, between 2005 and 2022, so it's a lot more than 15 years, we have been driving this campaign. Slide number 55. What about clean hospitals? I will use exactly the same approach. Where did we start? What did we do? Where are we today? Where do we go? Slide 56. What is Clean Hospitals? It's a coalition of international stakeholders who work explicitly to promote and support healthcare environmental hygiene. They do it through research, publications, participation in conferences and events, education and training, and specialized working groups. Next slide is slide number 57. Where did we start? Where do you start when you are so ambitious to drive such a campaign? Well, we started by identifying the need. The healthcare environment remains a major gap in IPC. We want to identify the need. We need to address silos and fragmentation in the field. So the Clean Hospitals Initiative was launched in 2018 for the very first time. Let's move to slide 58. The role of healthcare environmental hygiene in disease transmission clearly depends on the setting. Between 50 and 70% of healthcare-associated infections are caused by contaminated hands. The estimates are that between 20 and 40% of healthcare-associated infections are spread to the healthcare environment. So, as you can see, it's a very large number, obviously. Slide number 59. If I take Europe only, healthcare-associated infections, currently 1 out of every 15 patients will get a healthcare-associated infection during their hospital stay. If we were able to reduce by 20% through improved healthcare environmental hygiene, that would mean that 1 over 19 patients only will get a healthcare-associated infection. If we were able to reduce 40% to improved healthcare environmental hygiene, that would mean that only 1 over 25 patients will get a healthcare-associated infection. Next slide is slide number 16. Well, there are very important questions in this field. Who cleans what? Everyone is crucial to the outcome. It's very clear. And there are many people involved in the field. The logistics of healthcare-associated infections and healthcare environmental hygiene need to be understood. The relationship between the nursing department and the infection prevention and control department is important. Now, importantly, and a very important next slide is slide number 62. There is a multimodal strategy for healthcare environmental hygiene, the same way there is a multimodal strategy for clean hands. We are currently working on making sure that people understand this multimodal strategy. It's made of system change, training and education, monitoring and feedback, workplace reminders, institutional safety climate. Let's move to slide number 63. There are 5 elements in healthcare environmental hygiene. System change, access to the necessary products and supply, training and education of environmental staff, managers, and raising awareness for other healthcare staff and administration. Monitoring and feedback of performance, how clean is clean, and optimizing feedback for improving performance. Workplace reminders, safety posters, events, and so on, as well as institutional safety climate, career advancement, ability to communicate with nursing staff, and up to the hierarchy. Next slide, slide number 64. System change means availability of tools, supplies, and machines to cleaning and disinfecting surfaces, to treat air when needed, to sterilize and reprocess medical devices, water treatment, waste treatment, laundry. Slide number 65, training and education. Training of staff for cleaning and disinfection is so important. How to operate the equipment, how to do specialized tasks. You can do it through classrooms, of course, it's obvious, but you can also use all sorts of more modern systems like manual trainings, job trainings, e-learning, and so on and so on. Next slide is looking at monitoring and feedback. Monitoring cleaning staff or environmental hygiene staff through visual monitoring, ATP measurements, fluorescent marking, or rarely with microbiological sampling. And then, of course, there is no need for having results if you don't feedback those results to the staff. So feedback can be given in either a constructive or punitive way. I very much prefer constructive way, and either at individual, team, or institutional level, or a combination of those levels. I have no time to enter into the details of those approaches, but I can tell you that they are extremely important. Next slide is slide number 67. And as you can see here on the slide, we are looking at a poster. This poster is improving environmental hygiene practices through the concept of risk zones. When risk increases, frequency of cleaning must rise. As you can see, from risk level 1 to risk level 5 on this poster, which is just one example of the Clean Hospitals posters that have been produced. Those posters are working as workplace reminders to help staff in their task of cleaning the environment. So importantly, required safety posters, individual reminders, additional activities, and events for raising awareness are extremely important. It used to be that we would tell the cleaners, go and clean. Today it's not enough. We need to teach them. We need to put value in their work. We need to empower them. We need to be able to develop instruments in their own languages and to make sure that they understand those instruments. All of that is important when you are working on workplace reminders, and as you may understand, and I'm going to my next slide, 68, this is part of institutional safety climate. Well, institutional safety climate, we know very well for many years in the field of hand hygiene, don't we? Yes, we do. But all the effort will be totally insufficient without the support from the entire institution. And that's very important, and that's one of the very important tasks of Clean Hospitals, is to make sure that the environmental services are very well positioned, are heard of, are well linked to infection prevention and control programs, and that the indicators that are used are among the key indicators of the hospital. And it is all part of the safety culture. Next slide is slide number 69. Multimodal studies in healthcare environmental hygiene. I have no time to go into the details of those studies, but I can tell you that a lot of studies have been conducted. We recently published a systematic review of those studies that proves that there is an increasing number of interventions in healthcare environmental hygiene that are multimodal in nature. And we are back to this multimodal approach of infection prevention and control that is so important to all of us. Many of those strategies bundle some of the 5 components of the multimodal improvement strategy for healthcare environmental hygiene into a single complex intervention. And that's very important to understand that, because if you don't understand that, you will have difficulty to really improve healthcare environmental hygiene. Slide number 70 is telling you optimizing healthcare environmental hygiene. Because optimal environmental hygiene is as much about the product as it is about institutions and people. So one of the take-home message that I'm giving to you today, and that is obvious for many of you, and in particular if you have been successful at promoting hand hygiene using the multimodal strategy for hand hygiene promotion, you will understand that to promote healthcare environmental hygiene is about the same process. It's about implementing a multimodal strategy whereby everybody is involved. But as mentioned in the slide, it's not only about the right products. It's about having institutions making the right things and people, the right people, being part of the promotion strategy. All elements need to work harmoniously for improvement, obviously. Next slide is the slide number 71. On slide 71, I tried to first address where did we start, and now I will address what did we do. Slide number 72. Well, what did we do? Remember, we started in 2018. Well, we brought together academia and industry. Why? Well, to champion the science, best practices, and evidence-based solutions, to drive and support academic research, to create a network where project members can exchange and collaborate, and to create a platform from which to bring healthcare environmental hygiene into the spotlight. And the last issue is extremely important. Actually, all four are important, but I would like to insist on the fact that we need to bring healthcare environmental hygiene into the spotlight. It has been certainly highlighted a little bit during COVID, but we need to do a better job. We need to continue to do it because we really want healthcare institutions all around the world to understand the concept. Next slide is summarizing for you 2021 of the Clean Hospitals activity in one slide only. So it was a very busy year despite of COVID-19 for the team of Clean Hospitals. We had 7 peer-reviewed publications. We were in 20 conferences in person or remotely. We ran 2 teleclasses and webinars. We had the Clean Hospital Day teleclass with 37 live attendees, thanks to Paul Weber, and over 88,000 on-demand attendees, thanks to Paul again. We had a teleclass on COVID and fake news, 38,000 attendees during live sessions. We had many other activities, as you can see here, including 2 digital days, 1 Global Clean Hospitals Day, and 1 book chapters, and hundreds of publications, with a major increase in abstracts submitted and published at the ICPIC meeting in the year 2021. Slide number slide number 74 is just showing you a list of publications in the last 2 years from the Clean Hospitals team, Alexandra Peters being our main lead scientist, being the first author of many of the papers, as you can see. And on the slide number 75, you see the rest of the other publications of the last 2 years, just to give you an idea of the intensity of our research activity. Next slide, 76, the Clean Hospitals Day. Today is the 20th of October, and it is the Clean Hospitals Day. So every year on the 20th of October, we will celebrate clean hospitals. We will hopefully continue to have a Weber teleclass if Paul agree with the proposal. And the year 2020 was focused on COVID-19. 2021 was focused on cleaners because, as you know, the 19th of October is the day of cleaners, as was this year the 20th of October. We had many videos. We had this teleclass that I told you about earlier. We had webinars, and we had a huge company involvement as well as activities on social media. Today is 20th of October 2022. Slide 77. Where are we today is the question. Where are we today? Slide number 78. Today we are continuing our research and academic work. We are expanding our network and connections with industry in particular, with a group and associations also. We are finding new ways to champion healthcare, environmental hygiene, and patient safety. Slide number 79. It's clear that COVID-19 sensitized the whole world to contact transmission, right? Hands and environment, it's clear that hands are a hypermobile prolongation of the environment. Well, the good news, and this is from my friend John Hutter, environmental hygiene and IPC awareness were increased. And John used to say, never waste a pandemic to promote what you have to promote. As well as in the hospital, we never wait to promote once we are supporting an epidemic. Next slide is slide number 80. I told you that we published this systematic review, impact of environmental hygiene interventions on healthcare-associated infections and patient colonization. I encourage all of you to access this systematic review published in ARIC, Antimicrobial Resistance and Infection Control, by the Clean Hospitals Group. It's a fascinating study. I have no time to go into the details of the study, but the next slide, 81, is summarizing for you the main conclusions. The healthcare environment is important for patient safety. There are numerous environmental hygiene interventions that can reduce healthcare-associated infections. The evidence is there. We need more and better studies designed to measure colonization and healthcare-associated infections. Importantly, when we conducted this review, and that's a very important take-home message, we excluded interventions where hand hygiene was promoted. So it means that our review was concentrated on healthcare environmental hygiene interventions only, so it's very clear that it is more difficult to document. And of course, by doing hand hygiene promotion and healthcare environmental hygiene promotion, it's clear that we will reduce more and more healthcare-associated infections. Next slide is slide number 82. We also published the results of an international pilot survey on healthcare environmental hygiene at the facility level that we conducted. This study is very important because it helps you to understand the level of healthcare environmental hygiene that is currently worldwide. And I encourage all of you to access this paper in the American Journal of Infection Control that we published in 2022, actually this year. Next slide is showing you, slide number 83, a summary of the pilot survey results. Healthcare environmental hygiene programs are insufficient across resource level all over the world. With one key message, 98% of healthcare facilities, and remember it's a worldwide survey, were majorly lacking in at least one of the components of the multimodal strategy. It means that wherever you go around the world, in any hospital, you can find room for improvement. Next slide, slide number 84. You see here, obviously, the hand hygiene self-assessment framework with, as you know, a range from 0 to 500, where you can classify the level of hand hygiene into 4 basic categories. We are driving the exact same strategy for the so-called healthcare environmental hygiene self-assessment framework that we are currently developing. Next slide, slide number 85. Here is the Gantt chart of our work, developing this instrument that will be available to all of you very soon. that is currently available to all of those who want to test it in a third-step validation, the tool. But as you can see, we are progressing with the development of this tool. Next slide is slide number 86. And it is entitled, Where Do We Go? And that's a very important question when you want to develop such a campaign worldwide. Let me tell you where we go. We conduct continued research and publication. So we published academic papers as well as white papers in peer-reviewed journals. We developed, test, validate, and diffuse the healthcare environmental hygiene self-assessment framework. And probably in the next teleclass next year, we could show you more about this instrument. We are running the Clean Hospital Day conference today on the 20th of October 2022. As Pierre Parnex told you earlier, we had a fantastic day. And for those accessing Twitter, you will see the activity on Twitter of the conference. The program is currently under preparation for our activities in 2023. Next slide is slide number 87. Steps to take for the future. How can we do better is the most important question. Growing the Clean Hospitals initiative is really important for all of us. Working on addressing gaps in the field. Develop, test, validate, and diffuse the healthcare environmental hygiene self-assessment framework. Work to include all relevant stakeholders globally. Our initiative is global. We have companies from all around the world. We have experts from all over the world. We keep the momentum post-pandemic because this is really important. So let me tell you, next slide, 88, what we did on Clean Hospitals Day today. Slide number 89, we celebrated having this one-day conference in Geneva, one-day international scientific conference with lectures, meet the experts, industry-sponsored sessions, industry exposition. Next slide, slide number 90. You see here, for those interested, you can access these and look at the program, but I will show you the program that we had, slide number 91. Now, it gives you a flavor of the field for Clean Hospitals to look at this program of today. First session was environmental control, healthcare surfaces, how clean is clean, evolution of biocide standards and regulation, a few clouds on the horizon. The talk was given by 3 members of 3 different companies, partner of Clean Hospitals. Then we discussed about true sustainability, the only way forward. The second session was dedicated to healthcare environmental hygiene self-assessment framework. We discussed and described the survey, the tools, the transposable model, and then we did a deep dive into the Geneva model for environmental hygiene. Next slide, slide number 91. We then had 3 industry-sponsored symposium, as you can see here, and then we moved to the third session, medical device reprocessing, guidelines for validation, discussing new European guidelines, example of national adaptation, the so-called Swiss checklist, and then discussing challenges and strategies for endoscope reprocessing. Next slide is slide number 93. We then had again 2 mini symposia sponsored by company. And last but not least, we discussed air and water control with real-life experience of controlling Legionella in healthcare in France, as well as air control during construction in hospitals by a group in France from the Dassault Systems that is developing models to predict danger associated with the lack of air control. Next slide is slide number 94 to say that then we had an apéro, and I had to leave the apéro to come and join you and in this Clean Hospitals Day Weber teleclass, but I'm very happy to be here, and I'm glad we could meet tonight virtually thanks to Paul Weber system. Next slide is slide number 95. Now, importantly, it is very important to spread the word. Why is it so important? Because you know that, in fact, healthcare environmental hygiene is a topic that we have difficulties to speak of. Why do we have difficulties? Well, simply because it's not what I like to say a sexy topic. It's not a topic where you will ask young academic physicians to go in, because research is very difficult in this field, because innovation is mostly due to industry and company developing tools, and this is why we need to all sit together to develop new standards that would be universal standards and not standards that will be valid for one country and not the other. So there is a very, very important matters to spread the word on social media. So please go immediately to our Twitter account, Clean Hospitals, as you can see, with a bar between Clean and Hospitals. Look at today's activities, hashtag Clean Hospitals Day, and retweet our element, and follow our Clean Hospitals initiative. Next slide is slide number 96. How do I see the future of healthcare environmental hygiene? Well, it's important to say that it must be flexible, agile, and based on best practices. This is very, very key. There is a need to include all types of healthcare facilities, not just only hospitals. And when you think about it, with the COVID-19 pandemic, we have seen so many patients dying, of course in hospitals, but also in long-term care facilities, or even at home. And everywhere where care is provided, it is important that, of course, hand hygiene would be performed, but also healthcare environmental hygiene would be promoted and performed nicely and adequately and according to good practices. Next is that we must take into account the logistics, the production, the quality control, the communication that is needed in the field. And when you speak about communication, I don't know about your hospital, but in my hospital, who is in a French-speaking country, people in the healthcare environmental hygiene department usually hardly speak French. They speak in my hospital Portuguese, Spanish, Italian, German. They speak Kosovo language. They speak Indian language. So we have to really consider our tools in order to make sure that those people understand what we want to tell them and the way we want to work with them and the way we want to speak to them. There is a need for international standards for products and procedures. And as you have seen in the program of the one-day conference in Geneva on healthcare environmental hygiene, we put a real emphasis on international standards for product and development. There is also a need to include having plans in place for emergency situations from the international level to the facility level. And it is absolutely key to really understand that in the field of clean hospitals, in the field of environmental hygiene, there is an urgent need to have those plans in place for emergency situations, of course, but also to improve the basic level of healthcare environmental hygiene. Would the basic level of healthcare environmental hygiene be higher in hospitals around the world, we would have been much better facing COVID-19. So this COVID-19 pandemic worked like a spotlight to highlight and highlight our weakness in many fields in our society, but in particular in infection prevention and control and in healthcare environmental hygiene in many hospitals that I have had the chance to visit during this pandemic all around the world, including in my hospital, where we are handling very, very well, but still I could see the importance of healthcare environmental hygiene and the problem that we could face. The next slide is again coming back on my title, which is actually From Clean Hands to Clean Hospitals. Again, let me compare the two. Where did we start? What did we do? Where are we today? And where do we go? And the next slide, slide number 97, on the left-hand side, Clean Hands. Clean Hands showed the way to go from 1995 at the University of Geneva, and from 2005, 10 years later, from WHO, where I had the honor to lead the Clean Hands campaign. We worked by, as mentioned on the slide, reviewing the evidence and building intervention strategies, and it was absolutely critical. Then we monitored performance, progress, and time trends to ensure improvement and sustainability, and we developed tools to continuously improve sustainability, drive excellence, and so on and so on. If I compare the Clean Hands in orange to the right-hand side, the Clean Hospitals in green, Clean Hospitals was launched in 2018 only, and we are in 2022, and we had to face COVID in the meantime, right? The model is completely framed on the Clean Hands model. We review the evidence, we develop strategies, we monitor practices, and we ensured sustainability. Next slide is slide number 99. Follow and like me and like us, Clean Hands, Clean Hospitals. Access the website, the www.cleanhandsavelives.org, where you will also find the access to the Clean Hospitals. Hashtag hand hygiene, hashtag Clean Hospitals, hashtag Clean Hands, and for today, hashtag Clean Hospitals Day. Follow us, follow our activity on Twitter, Facebook, LinkedIn, and even Instagram for some of you. And make sure that all what we develop for you is useful and can be adapted to your level and to your hospital. The slide number 100 is listing for you the Clean Hospitals partners. As you can see, these are the companies with whom we are working on a permanent basis by using multiple stakeholder groups to develop new strategies, hoping that we will definitively improve healthcare environmental hygiene in the future. With these, I would like to thank you for your attention. I will turn back to Paul for the concluding slides.
Professor Pittet, thank you very much. Thank you for getting that done. It was always a professional job. And thank you to Pierre for his opening comments. On slide 101, there are a few teleclasses listed there that are coming up in the next few weeks. Those of you who are looking toward the CIC exam, there are in fact 2 teleclasses in November that deal with CIC certification, both of them free registration. Feel welcome to join both. And on the very last slide, I'd like to acknowledge our patron sponsors, Diversey and Virox and Purell and Gamma. These organizations make teleclass education financially possible, and I'm very grateful to them. To all of you, thank you very much for joining us. And Professor Pittet, again, you're a champion of teleclass education, and I am one of your biggest fans. So thank you very much for doing this again, and we'll talk to all of you again very soon. Goodbye.
Thank you, Paul, and thank you to everyone. Thanks. Bye-bye.